Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Great, fantastic. Dr. Rogers Kane is our co host, and we will begin the discussion tonight. So, we all have probably heard that it's open enrollment for many insurance plans. And tonight we're going to be talking about Medicare. Now, I must admit, I'm not Medicare age yet. However, I think it is wise that any of us who have parents or grandparents, we should learn as much as we can about Medicare. And if we are approaching Medicare age, we shouldn't wait until it's time to enroll. Tonight, we have two distinguished panelists who will answer all of our questions, or at least some of them anyway, about Medicare. We have Mr. Brian Hicks. He is a broker with insurance services, and Mr. Earl Jones, who is also an independent broker. And both gentlemen are experts in the field. As best as they can, they will answer most, if not all, of our questions about Medicare. And don't forget, if any of our listeners have any questions, feel free to chime in as we open the discussion or begin discussion. Mr. Hicks, how are you doing this evening? Brian, are you there? Is your line muted? Okay, so I'll go to Earl Jones. How are you doing this evening, Earl?
I'm pretty good, Jocelyn. Thanks for asking. How you doing?
Oh, I'm doing just peachy. Dr. Kane, are you there yet? Looks like a couple of our folks are having some technical issues, so we will, if you would just bear with us. As you know, we started the podcast only a couple of months ago, and Dr. Rogers Kane, myself, and Tyrone Jackson, our technology expert, we've met for months and months and talked about how we could bring this much needed resource to our community, not only here in Northeast Florida, but wherever you are, you can sign in through Podbean to our podcast. Dr. Kane, are you with us yet? Mr. Hicks, how about you? Well, Earl, looks like it's just going to be you and I tonight.
Yeah.
Hopefully not. Hopefully Tyrone is working with Dr. Kane and Brian to get them started. We will give them a couple more minutes. So, Earl, until the technical glitches are worked out with Mr. Hicks and Dr. Kane, we're going to go ahead and get and start the discussion so that our listeners who have already tuned in, they'll be able to hear, because they joined in to hear about Medicare tonight. So, how about it, Earl? Are you ready to begin the discussion? It's just you and I.
Yes, ma'am. I'm ready.
So, Earl, tell me, what is Medicare, and do you get it automatically upon turning 65 years of age?
Okay, that's a good question. Well, to begin with, Medicare is health insurance for people 65 or older. You're first eligible to sign up 3 months before you turn 65. You may be eligible to get Medicare earlier if you have a disability. For example, end stage renal disease or ALS. It's also called Lou Gehrig's disease. Um, so, yes, you can enroll only 3 months before you turn 65.
And are you automatically, so you mentioned that 3 months before you turn 65, is somebody, am I going to get a notice that, hey, you're now on Medicare, but what if I already have health insurance through my employer? How's that impacted?
If you already have it through your well, to rewind a little bit, no, you do not automatically get
Okay,
enrolled.
okay,
And if you're working, you do need to, you can continue the coverage if they offer coverage. You can continue that while you're working. But if you decide that you're going to stop working, I believe it's an 8-month period. When you stop working, within those 8 months, you need to be enrolling before you accrue any penalties. And penalties happen once that if you don't do it within that time frame.
Okay, thank you. And I know there are a lot of types of Medicare. And are they all mandatory when you turn 65 years of age? I understand there are 4 types of Medicare.
There are 4 types. There are penalties. Like I said, there's penalties if you do not enroll, especially Part B and D. Part A
Hmm.
is a cost free. Generally, someone that's worked a good part of their life will automatically get Part A cost free. Generally, people that may have moved to this country recently and hadn't um, built a lot of years of time working where they will
Hmm.
get A automatically. So Part A is hospital insurance. It covers inpatient care, skilled nursing facility care, hospice care, home health care. Part B is a little different. That's more medical insurance. It helps cover more outpatient care services from your primary care doctor, other healthcare providers, home health care. It also covers durable medical equipment like wheelchairs, walkers, hospital beds, and other equipment. It also covers preventative services like screening, shots, vaccines, and yearly wellness visits. Oftentimes they do wellness visits where they'll come visit you at your house. And then there's Part D coverage. That is your prescription drug coverage. That helps cover the cost of prescription drugs, including recommended shots or vaccines. You can join a Medicare drug plan in addition to original Medicare, or you can get it by joining a Medicare Advantage plan where it's sort of built in with drug coverage. Um, and also, plans that offer Medicare drug coverage are run by private insurance companies that follow rules set by Medicare.
So
And then,
now I got Part A, B, and D. Did I
y-
miss one?
yes, there's one more, and the last one is Medigap, or what they call Medicare Supplement. Um, Basically, that's like an extra insurance you can buy from a private company that helps pay your share of costs in original Medicare. Policies are standardized. In most states, they're named by letters like Plan G or Plan K. The benefits in each letter plan are the same no matter which insurance company sells it. And that's the 4.
Wow, I must admit, Earl, I've never heard all the 4 types, so that was real interesting. I tried to take notes as you were writing, so at the end of the show, we'll make sure that our listeners have your contact information because I think it's a lot to ingest. Is there a cost for each of the plans?
Like I said, generally those have worked a good part of their years get Part A cost free. Part B, there is a monthly premium, which is I think it's about average about 148 each month. That could be higher depending on your income. If your income's over a certain amount, you it may be a little higher. Um, and like I said, Part A is generally cost free. Um,
Okay.
and then another part I mentioned was the penalties. Now you can if you get a penalty for not enrolling on time, your monthly premiums will be higher, and generally they stay higher during the duration of the time that you have this coverage.
So that sounds like then you need to enroll when you turn 65 because if not, you're going to be penalized.
Right. And if you're, like I said, you can be working past 65 and you don't have to enroll at 65 if you're still working
Okay.
and you have coverage
Oh,
through your
okay.
employer. And like I said, that is that 8-month period within when you or your spouse leave that job where you have to enroll. So you got an 8-month window.
Oh, okay.
Are we there?
Wow. So, hey, Dr.
Yes.
Kane, thank you.
Oh, finally. I'm not
Can
sure
you hear
what
me?
happened. I just got excluded.
Brian, is
Brian,
that
can you
you as
hear us?
well?
Yes. Yes. Can you
Oh,
hear me?
fantastic.
Oh,
Yes, finally.
Okay.
Poor Earl, he had to just listen to me tonight in our list, although Earl was giving some great information. But thank you, Dr. Kane and Brian, for joining us. The discussion. Earl was just explaining to our listeners and me, quite frankly, what the 4 types of Medicare. He explained parts A, B, D, and Medigap. So we've only gone through a couple of questions. So Brian, I'm glad you joined us. So now Earl won't be left alone to answer our questions. We were talking about, Brian, that for those persons, any of our listeners who may be approaching age 65, and if they're working or not, and if you don't enroll in Medicare, are you penalized? So what are your thoughts on that?
Well, it just depends on whether or not they do have credible coverage. Now, if they're working, of course, they can sign up for Part A, and they can get a special enrollment for delayed Part B. But typically, you do want to sign up when you're turning 65, and unless you have other coverage, obviously, and you're still working.
And so is there a cost for each of the plans?
Well, it depends on how they're trying to access the Medicare. If they're trying to access it through Medicare Advantage plans, you have multiple plans that have a zero premium. If they're trying to access it through the Medigap or MedSup system, there's a premium for that.
What is Medicare Advantage? I hear a lot of commercials now, especially now that it's open enrollment, and I've never understood what is Medicare Advantage in regards to the Part A, B, D, and all the parts.
That's actually a contract that the insurance companies have with the federal government. Their annual contracts with the Medicare Advantage policies, and the Medicare rule is that if they participate under the Medicare Advantage program, then they have to have coverages that are equal to or greater than what's offered in original Medicare. So,
and when you say if they participate, you're referring to if the insurance
carriers.
Okay, yeah, carriers. Okay, all right, go ahead.
I'm sorry, Dr. Kane. You said that, and I'm even more confused because I totally don't understand what do you mean the original Medicare? And
there's original Medicare where you can just have Medicare A and B, and then you can get a what's called a standalone prescription drug coverage, or you can elect. That's one way to access Medicare. The second way is the Medicare Advantage plans that you're referring to. You'll hear them referred to as Part C also. Those are the contracts I'm referring to that the insurance carriers have with the federal government, and they renew on a yearly basis. They have a star rating system, and that's another way to access it. The third way is through Medigap or Medicare Supplements. Now, with the Medigap or Medicare Supplements, Medicare is still your primary. And then the Medicare supplements pay after the original Medicare, because that's why I keep referring back to original Medicare, because original Medicare is when you turn 65, you get your Part A, and then you elect to get your Part B. That's original Medicare. All the other coverages are added to that. And that's when that's the only part that doesn't involve the insurance companies. That's the government program, the original Medicare, and that's why we refer to it as the original Medicare. There are a lot of people that go ahead. Sorry.
Yeah. So do you, before you leave that, well, you mentioned Advantage, and I'm still confused. So do I get the original? Can I have the original Medicare and Advantage, or is that two different things?
You never lose your original Medicare.
Okay.
It's a requirement to have the Medicare Advantage or the Medicare Supplement.
It is not?
It is. It is a requirement.
Oh.
You never lose your original Medicare.
Okay.
That's the red, white, and blue card.
Okay.
And that's the original Medicare. Parts A and Parts B.
Okay.
So if you decide you want the Medicare Advantage plan, you want to access the system that way, then the Medicare Advantage plans become your primary insurance. Now, what happens is that with that situation is that as the primary insurance, the insurance companies are being paid by the Medicare Trust Fund to to go ahead and process the claims, also provide the coverages, and provide services to the beneficiaries.
Similar to what the insurance companies do. And Dr. Kane, I promise I'm going to let you ask a question. Similar to what the insurance companies do when we have, before we turn Medicare age, when we have options of insurance plans, when we go through our insurance plans for our coverages. That sounds like it's similar to that. Am I right?
Correct, because
Okay.
you don't have to have either the Medicare Advantage plans or the Medicare supplements. You can just
Okay.
have the original Medicare.
Okay. Dr. Kane, it's on you. I promise I'm not going to ask all the questions.
No. And I'm absolutely fine because, and when I talk to patients, they're asking me some of these same questions. But what I want to, two things I want to ask. Well, the first thing I want to ask is, so the original Medicare would basically mean just the basic Medicare is what I'm gonna call it. Basic Medicare. I remind patients that it's only going to cover 80% of the, up to 80% of the charges that you may receive from whatever entity, whether it's a hospital or a doctor's
That's
office or whatever.
that's right,
Is
Dr.
that
King. But
right?
that's actually on that's more relative to the Part B portion. There's an
Right.
actual deductible for Part A. Because a lot of people are on Medicare Advantage or Medicare subs, but there's a deductible of 1484 that on 1480 $1,484 for the first 60 days
Got it.
for Part A, and then under Part B, that's where you typically get the 80/20 coinsurance.
Got
When
it.
you visit
Got it.
the doctor's office or have a outpatient surgery, then Medicare pays 80%, and this is more prevalent to the supplements though. They pay 20%, and the supplements pay 20%. So that's it's dissected between the two, because the 20% doesn't really come into play on the Part A portion. It comes
Right.
into play
Okay.
on the Part B.
Yeah, but then they still have to meet that $1,400 and some dollars deductible.
If they go in
Got
the
it.
hospital,
So
yes, whether it's 1 day or
yeah,
60
yeah,
days.
right. Okay, got it. So, but Mr. Jones, just to address something with you that you said earlier when I could hear you, but I couldn't say anything. Your sign up period starts about 3 months before your 65th birthday.
Yes, correct.
But there is a time that it ends, right? That sign up
Three,
period ends and you begin to get penalized.
right.
When
It
is
will be
that?
3 months after your birthday. So you got pretty much
Got it.
it's like a 7 month window. 3 months before your birthday, the month you turn 65, and 3 months after.
That's what I want to make sure people understood, because if they, some people just jump up and think that, oh, well, I have to sign up before my birthday, otherwise I'm going to be penalized. But there is a 7 month
Mm-hmm.
window in which you
Mm-hmm.
compare sign up. Very
Right.
good. That's what I wanted to do.
Right.
Now, must a person enroll in Part D?
Part D, well, they should, because they can get a penalty if they don't. And the penalty is not just a 1 month penalty. This penalty will go on, and correct me if I'm wrong, but this penalty, I think you get 63 days or more without credible drug coverage, and the
Okay.
penalty will go as much as 1% extra for each month you could have joined. So basically, that's 12% a year if you waited a whole year to not get Part D coverage.
And is that for the rest of your life?
Yeah.
Yeah,
I'm
it's
sorry.
pretty
I
much as
apologize.
long as you're getting covered. Yes,
Okay. Yeah, and that's what I
and
mean. As long as
you
you
can jump
use
in,
a
Eric,
Medicare.
if
Uh, yeah,
No,
Brian.
I
Brian, I'm
apologize,
sorry.
sir. I apologize, sir.
No, go ahead. He was saying you could jump in. Was there anything that you wanted to add
Well,
to
the
that?
the 1% is based on the national average of the what the standalone prescription drug premium would be per month. So if
Hmm.
the average premium per month is $40, then each month that you don't sign up after the 63 days, then it starts to tally up at 40 cents a month, and it is permanent. So if you go, a few years, then which I've had clients that have done that, then it can start to add up, and it is permanent.
And
And the
you
only
just
way
use
you can't.
$40 as I was going to say. You just use $40 as an example, right?
Well, um, for a long time, that has been around the average for the standalone, the average cost for the prescription drug plans, because you have some
Okay.
higher and some lower. But
Right.
and
Okay.
Medicare determines that though.
Okay. Brian, can you explain the donut hole to me? How many patients come and ask me about the donut hole? I'm in the donut hole. So what can you tell our listeners about the donut hole?
Well, it's officially the coverage gap, and basically what that is, without getting into the total minutia of it, is that your first, if you have a deductible, and
Mm-hmm.
this is only relative to prescription drugs. So if you have a deductible, that's stage one. Then there's the what's called the initial stage. And that stage happens that after you either meet your deductible or you have a plan that does not have a deductible at all. Uh, once once you once you get out of the initial stage, now most people stay in the initial stage where they pay small copays throughout the year. But then after, and then after you get, if you go into the coverage gap, then what's going to
Mm-hmm.
happen then is that you're going to pay during the time you're in the coverage gap, you're going to pay 25% of the cost of a brand of generic prescription drugs until you reach what's called the catastrophic stage. And in this case, which is a good thing. Then once you reach the catastrophic stage, then you have small copays for the rest of the year for any drugs that you have prescribed to you.
So how fast you get into that donut hole is depending what
Well,
the how expensive those drugs may be that you use.
absolutely, it's what we
Mhm.
call the true out of pocket cost for those drugs. So, and the coverage gap itself is the number between when you come out of the initial, like in when you come out of the initial coverage stage, and you go into the gap, you only charge more money when you go actually into the gap. So
Mm-hmm.
then once you come out of the coverage gap or the donut hole, then you go into catastrophic.
Ms. Turner.
I am so confused, Dr. Kane and Brian and Earl. I am going to need a tutorial by myself. But as I shared with our listeners early in the show, thankfully, I'm not yet near the age of 65, but it sounds like I need to start doing my homework right now. What is Medigap? And Earl, I think you mentioned that earlier. What is Medigap, and should I enroll for this type of plan?
Yeah. Well, Medigap is uh, Medicare Supplement insurance. It's extra insurance you can buy from a private company that helps you pay for your share of costs in original Medicare. So you need Part A and Part B to buy a Medigap policy. Some
Mm.
Medigap policies offer coverage when you travel outside the U.S. Generally, they don't cover long-term care like nursing home, vision, dental, hearing aids. Um, that's kind of where Medicare Advantage plans come in. If you're under 65, you might not be able to buy a Medigap policy, or you might have to pay more. So in most states, they're kind of named by letters like G or K. The benefits are in each plan or letter are the same, no matter what company sells it.
I just don't, now I understand why there's always so much discussion about overhauling the healthcare system in the United States, because it sounds like it takes a PhD to get this, unless I'm just not getting it and won't get it until I turn 65. But sounds like I need to enroll in A, B, C, D, E, F, G, H, I, J, K. I'm being facetious, but this is all so confusing. And for some folks who help their parents and grandparents with this, I mean, really, this is very confusing, and sounds like Dr. Kane has the discussion as a primary care physician. Dr. Kane, sounds like you have been helping some of your patients navigate this. Is that right?
Yes, and correctly or incorrectly, yeah, I have been trying to help them navigate this. But I can tell you the truth. I can give them some of the basics, but I go to guys like Mr. Hicks and Mr. Jones, who are the more have the greater expertise in this
Mm-hmm.
field, and I refer patients into those guys. That's why it's so important before we get off this particular broadcast that we let people know how they can reach either one of these guys, because they need, it's almost like they need to hold your hand to navigate through this intricate, complex maze of Medicare. I mean, and that's why it is. I'm a proponent of universal health care if it was up to me, but that's a different story.
So am I. That's another conversation, right?
Yes, right. That's
So,
another conversation.
yeah, one of the things, though, that we haven't talked about, I know oftentimes when you're working or when you're younger than 65, some of us tend to choose health plans based on what providers are in the network. So, Brian or Earl, do all plans have a network of providers for some or all types of services? And I'd like for both of you to answer, so I'll start with you, Brian.
On the Medicare Advantage plans, you typically, when you have, because you're going to have your HMOs, which is what stands for Health Maintenance Organizations, your
Mm-hmm.
PPOs, which is Preferred Provider Organizations. They have a base network. But when you get into your Medigap or Medicare Supplement policies, that's one of the attractions to those policies, that there's no network. And anywhere that takes Medicare will take your Medicare Supplement, and also understand the fact that with because the Medicare is still your primary in that case. So the networks are more relative to the Medicare Advantage plans, unless you get into some of the more obsolete plans, and I don't want to get into the minutia of it, like the PFFS plans and some of the other plans where you can pay for fee services, whereas as long as the doctor or the facility accepts will accept the term of the policy, you can pretty much go anywhere. So that's still on the Medicare Advantage side. But for the most part, in general, yes on the Medicare Advantage side, no on the MedSup side.
But what is the traditional? You say the Medicare Advantage, though. If I don't have, I thought that Medicare Advantage was optional, but I will always have the traditional Medicare. So does traditional Medicare, how about the network of providers for that? Or
I
traditional
can
Medicare doesn't?
Okay.
I can jump in.
Go
So
ahead, Earl. Go ahead, Earl.
original Medicare, you can go see any doctor or hospital that takes Medicare anywhere in the U.S.
Okay.
When you starting to look at Advantage and Supplement, you start to when you start to look at Advantage plans, that's when you start to look at networks, and
Okay.
you would generally want to stay with providers in the network, so you don't have to pay more out of pocket.
Okay. Thank you. And I know earlier you talked about the benefits like vision, hearing, dental. Now, was that Medicare? I mean, was that the part B or D? No, D is
Neither.
prescription. Neither.
It's
Oh,
neither.
see. I told you, Brian. I still need help, man. I'm so
Yeah,
confused.
so that's added value that has become more aggressive in current years, because at one point in the earlier years, especially in early 2000, 1990s, they really didn't focus on that as much. But now the focus is on selling added value policies, which in some cases can, depending on a person's thinking, can work to the detriment of that individual because they really need to stay to the basics because they need to make sure their doctors in the network, whatever facilities that they prefer to go to are in the network. And then from there, look at some of the other benefits that are offered.
The one thing I'd like to chime in on real quick is that, well, two things. One of them is going to be a personal opinion, but the first part is that a lot of times my patients will ask me that when we ask, I say, what insurance does you have? And they'll say, oh, I got Medicare and I'm not going to name a particular Medicare Advantage plan, but then they name that Medicare Advantage plan. And they tend to think that they are two separate entities, that if they wanted to use the traditional Medicare, they can use it separate from the Medicare Advantage plan. And people have to understand, nope. Once you sign up with the Medicare Advantage plan, and for lack of better description, the traditional Medicare takes a back seat to that. It comes up under that Medicare Advantage plan. And either one of you guys can correct me or straighten that out in terms of what the statement I made.
No, well,
Okay.
you're correct.
Okay.
Again, just to revisit, we talked about this before.
Right.
When you sign up for a Medicare Advantage plan, those are federal. That's a contract with the federal government with the insurance companies to provide those services that have to be equal to or greater than original Medicare. So
Right.
and as a matter of fact, it's illegal to have both a Medicare Supplement and a Medicare Advantage plan. And you won't be able to access your Medicare. Now, these contracts are only a year. So that's why we're back to annual enrollment period. And this is the opportunity for individuals to decide whether they want to get a different Medicare Advantage plan, stay with the same, or whether or not they want to go back to original Medicare and then possibly get a standalone prescription drug plan or a supplement. So, yeah. Go ahead.
I'm gonna ask in a second. Well, let me put it. I can go ahead and ask now since you said it, and Mr. Jones, you can jump in. So if they go back to the original Medicare plan because they didn't like the Medicare Advantage system, is there a penalty to that person? Can they jump back and forth between the two during sign-up periods or in the middle of the year? Because sometimes patients, they don't like that Advantage plan, and then all of a sudden they say, well, I want to just go back to my regular Medicare. Can they do that if outside of the period, the sign-up period that you have?
Well, I guess I'll take that, and Brian, you can correct me if I'm wrong, but generally when there's either the open or annual enrollment period, they can jump back into original Medicare if they don't like the Advantage plans. There are some special enrollment periods, say if they move outside the coverage area, where they can have a special enrollment period where they can do that outside of the normal annual open enrollment period.
Okay.
And Earl is right. He's right. There's a plethora of special enrollment periods that they can use, but they have to be specific special enrollment periods approved by Medicare. But generally, everybody waits till annual enrollment period unless they have one of those events happen.
Well, I'm gonna make this statement because you guys can't, since you guys are, you're independent contractors and you represent all. But I'm gonna make this statement and let the shoe fall where it may. I tend to see these Medicare, these additives like dental and eyeglasses, or not ophthalmology, but optic eyewear and stuff like that. I tend to view them kind of, well, let's see if I can get them, if I offer this stuff, say like silver, I'm going to say silver sneakers. I don't think that is just to a particular type of insurance company, but these things are things that people, I feel they use as a hook to get a patient to sign up on their Medicare Advantage plan when they should, I tell my patients, don't worry about those right now. Make sure you get the best plan for what can take care of your medical needs first. All the rest of this stuff you can, it's kind of like putting a little Christmas tree decorations but you need that Christmas tree first to cover to cover your ability to access your health care. Does that is that too far out, too far fetched?
Um,
Um,
go ahead.
well, go ahead, Earl. You want to go?
Okay, just real quick,
Go
just
ahead.
to address part of what you said.
Mm-hmm.
Original Medicare covers most medically necessary services, hospitals, doctor's office, other healthcare settings, but it does not cover some benefits such as like eye exams, a lot of
Mm-hmm.
dental care, and a
Right.
lot of routine exams. It just won't do. So I think that addresses part of what you said there, and I think that when you add in supplements and you add in Medicare Advantage, they come in with extra benefits that the original Medicare just doesn't cover. And some people don't care. Some people don't care about the vision and the dental. They're happy with their original Medicare. But I think there's some people that say, okay, well, I'd like to get my annual vision, my dental routine, stuff like that. So they'll start looking at the Advantage plans.
Well, let me make sure I get I explain what I was saying. I'm not saying that you should only do the original Medicare or anything. I'm just saying that some of them offer some of these other little perks or promote these other perks more because they're trying to have an advantage over another Medicare Advantage plan. I'm still a big fan of Medicare Advantage plans, dependent on that person's and their need. I'm still a big fan of that. It's not. I'm not after. I'm not attacking the Medicare Advantage plan system or idea. It's just when I see some of these plans offer some of the little extra perk above beyond some of the other Medicare Advantage plan, you need to actually look and see how well they cover your basics compared to the other plans. And then if they pretty much equal, then you can go ahead and look at those. Um,
Well, Dr. Kane, it in no way or fashion did it seem like you were saying that. And for the record, as a broker, as long as I've been in the business, our motto is the client comes first. I don't work for the insurance companies. I work for my
okay.
client. So I do wholeheartedly agree with you. And I tell my clients all the time that you want to make sure your doctors and facilities that you choose to use that's going to get you well if you have to use them are in the network. It's just a symptom of the industry right now because, like I
Mm-hmm.
said, in the early 2000s, in the 1990s, it was more risk management driven. And then they started to go to the zero premiums. The co-pays for the specialists and the primaries used to be a lot higher. So
Mm-hmm.
what happens is that the competitive nature of the industry is taking over the industry, and so and what they're doing now is that instead of being risk management first, it's like we'll give you money back on your Part B. Well, and I'm not saying any company in particular, but there are some companies that do that, but you may not have that many specialists in your network. So
That's what I'm trying to get
you give it's a give and take. So it really what it comes down to is that you have to get back. I agree with you. I don't have a dog in the race with the insurance companies because they court me all the time. Okay. So, and the bottom line is that that's where the industry has gone now. And before you didn't see all the commercials and things of that nature trying to support that, but they need to, in my opinion, and I've been around a little while, I think we need to get back to the core risk management and worry about making sure the person health is being taken care of first.
Mr. Jones.
Okay, I'm sorry, my mute button disappeared. I'm sorry. I couldn't even find it. So can you? I'm sorry. Can you repeat? I was reading. Can you repeat what you were asking there?
What the main thing the point I was trying to get across is and make a statement, but I wanted either both you guys to comment on it, is that the core of what you need to do is make sure that you see certain things in your Medicare Advantage plan. If your doctor's in network, if if the hospital is in the network, if more so than just the carrots that they're offering about some dental
Right.
coverage,
Right.
some eye coverage, that kind of
Right.
stuff. And that's
Yeah.
basically what I was.
Yeah, I totally agree with you. Because some, I deal with clients sometimes. They want to stick no matter what. They want their primary care doctor no matter what plan they're with. And some agents may say, hey, we have this plan, and their primary care doctor may not be with that plan, or some clients don't care about the prescription coverage because they don't take prescriptions. So it's a lot of it. I would say it's a case by case basis. Every client, it has different needs, and I think the best plans is requires agents to talk to the clients and see, well, what exactly do they need? Do they care about the vision plan? Are they happy with their original Medicare? Or sometimes the Medigap or the Advantage is good for them. They want the extra benefits, or sometimes, like I said, a lot of people, some of them don't care about that extra stuff, so they don't they don't really need it.
So, Dr. Kane,
Okay, Ms.
if I
Jones.
would,
Ms. Turner, go ahead.
so I'm looking at the comments, and thank you all for posting your comments. But I'm going to try to read one of the comments as Earl, you may have been reading it. Can we have them tell us what would be available for an individual who only has $2,000 budget after all other expenses? So I'm a senior who only has $24,000 a year to spend on Medicare, and I don't really understand what that means, but hopefully you do. So what would be available for an individual who only has $2,000 budget after all other expenses?
Brian, you want to take that one, or?
So
Well,
does that
okay.
mean
What I would recommend they do is contact you have the what you call Medicare savings programs, and you have sometimes they can qualify for extra help getting help with their prescription drug coverage. The Medicare savings programs may also pay the Part A and Part B deductibles if you meet certain conditions, such as the income. If it's lower, I can't remember the dollar amount threshold. Brian, you might be able to help me with that. But if they meet certain conditions, such as that the person mentioned, they may qualify for extra help in some of these programs that they have. And I would recommend they go to SSA.gov, Medicare.gov. And those resources are right there.
You know what, Earl? I'm glad you mentioned that because there are a lot of seniors who are sick and tired of being told to go online. They need somebody that they can talk to. And I'm glad that Dr. Kane shared that we're going to share both of your contact information for our listeners because I know, for instance, the elderly people in my life, they're not that I'm not going to even include the word that they're not computer savvy and therefore not able to go online and access stuff. So I just want to toss that out at you. And hopefully there's a number that they can call or reach out to one of you. Another question was, when should a person consider Medicare Advantage plan? I don't know if we've talked a lot about that or, based on what you've said, it sounds like it might be more advantageous to just stick with traditional or original Medicare because the Medicare Advantage seems to offer have too many, iffies on whether or not your provider is in there versus the original Medicare. As long as your provider of choice accepts it, you can go to them.
I'm gonna answer that before they do. as a physician, no, that's not true. There's a lot of patients that really need the Medicare Advantage plan. A lot of it is dependent on how sickly they are. Somebody who may be their doctor bills can get outrageous, and if it's a person they may have diabetes, high blood pressure, elevated cholesterol, then had a stroke, then had all these different things, and they may not be able. You talk about that $2,000 left over. That $2,000 left over, if you had regular Medicare, won't be enough probably to pay those bills in a month. So Medicare Advantage can offer. Yeah, Medicare Advantage that is just what it says. It has an advantage. It's just whether or not you fit whether or not they fit your needs and maybe your wants, and it's not going to fit. Not each plan, not the fact that it's Medicare Advantage will fit everybody's needs. There's no one size fits all. But now I let these two gentlemen go and say something on that.
Well, I
Mr.
totally,
Jones.
Dr. Kane, I totally agree with what you said there. And I think that kind of piggybacks off of what I was saying earlier. I deal with clients that their needs, everybody's needs are different. And like I said, some of
Right.
them, the vision, the hearing, the dental, a lot of them need that. Some, I talked to a client yesterday. He says, I don't need the prescription coverage. I don't take prescriptions. That's not something he really cares about. And that's just one person, but everybody's different. Some people take prescriptions and they need the vision care to wear glasses, and they need, to get their the teeth checked, and some people might not care so much. So I think it's the Advantage plans and the supplements have different options for different clients, depending on what they like.
So Earl, the Medicare Advantage plan that's the Part B and
C.
Oh, okay. Now I get light bulb just came on. Ding, 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 ding. Because I'm like, I don't get it. I don't understand. I'm totally confused. I want to see what another one question posted was, or comment. If I am a senior and in decade health, I have Medicare A and B. Why would I want any additional DE or other? Why should I consider Medicare Advantage?
Well, I mean, if they're happy with the original Medicare, they don't have to consider Medicare Advantage. I don't think if I said that, I apologize. I'm not saying people need to get Advantage at all. I think Dr. Kane said that too. Some people like, original Medicare. They don't need the extra stuff. But you said the person was in.
They said that
health?
I am a senior and in decade health.
Oh, not in great
decade.
Health.
No.
Not in good health.
No, that's not what I said. If I am a senior and in decade health, DECAD.
Yeah, what does
health,
decade mean?
I have no idea. I have Medicare.
I think they might. Maybe they're saying excellent health.
I don't know.
Okay.
And they just said I have Medicare A and B. Why would I want any additional DE or other?
If they wear glasses, if they're, Brian, were you there?
No, I'm here. Can you hear me?
Yeah.
Yes. Yeah. Go ahead, Brian. You want to say something?
Over the years, as our practice evolved, there's a lot of reasons why. Because the reason why the Medicare Advantage plans and the Medicare supplements were brought about in the first place was, number one, to make sure seniors don't have to file bankruptcy because of medical costs.
Exactly.
Because under your Part B, with the 80-20 coinsurance, your liability is unlimited. There's Medicare doesn't put any limit on that liability. So that's a very good reason. Now, as far as an individual not taking prescription drug coverage right now, what have you, the issue with that is that you don't know in the future. I mean, today you may not suffer a certain illness, but maybe 5 years from now you will. And the reality is 5 months. But what happened? What the reality is that if the longer you go out, the less options you have, the least amount of options you have, because you're older now, your health is not good. So now you don't have a open enrollment period for the Medicare Sup when you turn 65, where you don't have to answer any health questions, and you may not be qualified for a guaranteed issue on the Medicare Sup. And then if you haven't paid your prescription, you haven't paid into the prescription drug system, then which is a mandate, and then you're gonna be penalized for that. So as far as, because you can get prescription drugs, there's some out there as low as $13. If you really don't. Well, I don't know. No, they come with the Medicare Advantage plan and with the zero premium. But if they're standalone, because we're talking about somebody who is embracing original Medicare by itself. So, and I'm not just speaking from the standpoint of, as a broker or I'm talking just pure risk management. That's what I was saying. Over the years, this is the direction the industry is going towards as far as marketing to seniors. They're saying, well, okay, we'll give you a pair of glasses. We'll possibly get you some dentures, but with that understanding, if you really have a serious illness and you're in the hospital for extended amount of time, that's the real risk. Or you have a surgery or outpatient. Some of the outpatient surgeries are very expensive. So, but everybody's going to make their own risk management decision. I mean, there's some people who decide if they buy car insurance, if their car gets to a certain age, they don't even want comprehensive coverage to fix broken glass on their car. Right? They just want the liability what the law requires. So I mean that comes to risk tolerance and how they view their current situation. But that's the problem. We're getting away from the risk management and looking out and trying to. The original reason the Medicare Advantage plans and the supplements were brought into play was to make sure seniors would not have to file bankruptcy to for medical reasons. And that's why on the Medicare Advantage plans, for an example, they all come with a maximum out of pocket. So a maximum out of pocket level on the medical side that if it's $6,700 or $3,400, once you hit that plateau, then your bills are paid at 100% for the rest of the year. That's really, in my opinion, and in my opinion, it's just my opinion. That's what you have to be cognizant of, and that was the original plan for these plans.
So
Mr.
should I sign
Jones?
up for Medicare? I'm sorry, I want to, Dr. Kane, I wanted to,
Hmm.
I think we've gone past that because I want to move to another question. Should I
Okay.
sign
Okay,
up
go
for
ahead.
Medicare if I have veterans benefits?
How that works is that if you have access to the VA, now as far as veterans, okay, if if you're a vet, which I'm a vet too, if you're a vet and you have TRICARE,
Hmm.
then my suggestion is not to go with a Medicare supplement or a Medicare Advantage plan because TRICARE it allows the vet to go to the military hospitals and civilian hospitals. Okay. But if you don't have TRICARE and you just have prescription drug or you have limited access to the VA and to prescription drugs, now you may not. If, say, for an example, you don't have TRICARE, but you're using the VA to get your prescription drugs. Well, that qualifies as what Medicare considers credible coverage. So you won't be penalized. So you can go to the VA, get your prescription drugs. Now you have a choice of if you want to go with a Medicare supplement and use the VA for your drugs, you could do that. Or you do have some essential plans on the Medicare Advantage side that do not come with drug coverage. You can also engage those, and the reward for that is that oftentimes your copays are less.
Mr. Jones,
Okay.
that brings to mind. I gotta ask this, Jocelyn, because it brings to mind because in what somebody's writing in there. Dual eligible plans. Can you explain that to our listeners? Because not all our listeners are patients. Some of them are physicians.
Right, right. Okay, so what you call dual eligible or special need plans. Some people will qualify for Medicaid and Medicare. Some people have chronic conditions where they call them S&Ps or special needs plans, where their type of Medicare Advantage plan where they offer extra benefits for people with certain conditions that they may not get the resource or the benefit from original Medicare. Um, chronic cancer. There's a wide range of chronic illnesses, but they would, some people will, certain people with disabilities, they may qualify for dual plans. Correct me if I'm wrong, Brian. That's what I'm.
No, you're correct. The on the CSNPs, or the chronic illness special needs plans, diabetes is included, which is more prevalent. Heart disease. So that's the majority of the plans are covering that. But yeah, it's no, those now the dual SNP is based on whether or not you have Medicare, Medicaid, whether you're full Medicaid, partial Medicaid. Now, if you're full Medicaid, typically here in the state of Florida, legally you're not supposed to be able to be bound, what they call balance billed, meaning that you any amount that the Medicare Advantage plan doesn't pay under the dual SNP. That's not with conditions. That's with based on whether or not you have Medicaid. So with that, you have a situation where it has full dual, and they're getting most of their services taken care of either by Medicare or Medicaid. Now, if you're partial, what we call partial, and that's why, and Earl, you would agree with this. The role of a broker now is not just to write people in policies. You have to be educated in the Medicaid system, the other systems that are out there, because if you're not, then you possibly are putting your client into a policy that is not suitable for their needs.
Exactly.
So we go back to the guy with the 2000. The first thing I would try to find out is does he qualify, or has he tried to qualify for Medicaid? The second thing, if he doesn't qualify for Medicaid, is what we call LIS, low income subsidy, or extra help from Social Security. That will at least keep his costs down on the drug side. So that's what and that's what I feel is the core of what we're doing as professionals in this business, is making sure the risk management is there, and people don't get into financial trouble behind their medical bills.
Ms. Turner?
Sorry, I was muted. So how does the Supreme Court decision about same-sex marriage affect enrollment in Medicare?
Oh, you want to take that, or you want to take it?
I can address a little bit.
Go ahead.
So I guess from correct me if I'm wrong, but I think around 2013, 2014, the Supreme Court ruled that I guess there was some going on, and the courts ruled it unconstitutional. Where I think the Defense of Marriage Act, they made it unconstitutional. So because of the ruling, the Medicare is no longer prevented by DOMA, or Defense of Marriage Act, from recognizing same-sex marriages for determining entitlement to or eligibility for Medicare. So the Social Security Administration, they're able to process requests for Medicare Part A and B, and address, I guess, certain eligible people in same-sex marriages.
Okay.
Great.
Brian, did you have anything to add?
Well, where that comes into play the most is that when you qualify, now you as an individual qualify for Part A, you have to have what we consider 40 quarters of employment, which is equivalent to about 10 years paying into the system. But there are people who are stay-at-home spouses that if they're, it's traditional marriage is just accepted, because if there's a stay-at-home spouse and the spouse doesn't have the 40 quarters, then they can access Medicare based on the qualification of their spouse. If you don't allow that for same-sex marriage, then they will be shut out of the Medicare system altogether.
So eligibility is based on how much if you qualify, if you've paid 40 months into it. So if someone is
No,
paying 40 months,
40 quarters. 40
no.
quarters.
40 quarters
quarters.
of
I'm sorry,
working
Mm-hmm.
employment. It's about 10 years.
10 years.
Then
Okay.
that's when you get the Part A at no cost typically.
So
Now,
then, if am I correct? Then it means that because of that Supreme Court ruling, that same-sex marriage couples, that if they are eligible with the 10 years, then they can qualify for
right,
Medicare.
based on their spouse, yeah.
Okay.
I mean,
Okay.
I've had clients that they've been divorced, and the divorcee would qualify for Medicare. And I've had clients that moved on and married somebody else, and that divorcee would, because of the years they stayed at home and raised the children or whatever and didn't work, they would qualify for Medicare based on their spouse.
The X.
Yeah, the ex, yeah,
Ex.
Oh,
Yeah,
okay.
the ex-spouse.
yeah. Well, not a long time ago, a few years back, when everybody's red, white, and blue card had their social on it, you could tell whether or not a person fell in that category, because usually before they had the Medicare numbers they have now with the numbers and letters, they had a person's social, and it would be followed by either a letter A or a letter D. The letter A would means that that's the individual beneficiary is the same, but the letter D means that they qualify based on their spouse.
Okay.
The
Dr.
Turner,
Kane?
go ahead.
Oh no. Oh, okay.
Well,
So how do
that's
I
you.
sign up? I mean, how do I sign up for Medicare if I will be 65 the end of this year? Well, not the end of this year. If I'll be, let's just say if I'll be 65 in August of next year, do I just wait until the 3 months before? I know Earl mentioned that at the beginning, that about 3 months beforehand, I should receive notification that I am now eligible for Medicare. Do I wait for that, or do I need to initiate signing up for it?
Well, you won't be able to until that 3 month window begins. But you can go to Medicare.gov. You can contact Social Security at www.ssa.gov. And there's another 800 number. It's, I don't know if y'all writing this down, but it's 1-800-772-1213.
772. Can you
One
repeat that, please?
1-800-772-1213.
1213.
Yes, ma'am.
And what's that number to?
So Social Security.
What does Social Security have to do with Medicare? I'm sorry.
Well, they provide resource. Well, they provide resources for people that are eligible to enroll, and it will,
okay.
Even resources such as getting extra help in their state.
The bottom line with Social Security, they want the money for the Part B, and that's typically comes out of person's Social Security.
Oh, okay.
Right.
Yeah.
Listen, you can tell I'm not 65, nor am I anything remotely expert in all things insurance. I'll just pick up the phone and call one of you guys. So thank you for allowing me to share my lack of knowledge about, my experience. For our listeners, is that I spent the bulk of my career in public health. So my job was trying to work with people to stay healthy. Now, once you got older and unhealthy, then I passed them on to Dr. Kane. Dr. Kane, it's on you.
All right. So I guess that's a dual eligible. It's on me when you pass them on, and now it's on me to talk to the. Okay. All right. So we're coming up to a near time that we, getting an hour into the show, and because we try to stay cognizant of our listeners' time, it's so much more information, so much need for understanding that we would love to be able to provide additional time for these guys to help explain to our listeners. However, what we can do with that, how we can best work that, is I'm not going to give out a website because a lot of the seniors are not going to get close to a computer, or they may not have a computer. But I do think we need to have each one of these guys, not only we should put it in the chat, but we should let them go on ahead, give their contact information, because they can be so valuable to all of our listeners. Both of these guys can be very valuable. And that's not stuff we do a lot of, but I want these guys to go on ahead and give their contact information for our listeners who want that additional input from the experts and the additional help from these experts to go on ahead and give it to them. So I can start with Mr. Jones, if you want to give us the information for
Okay.
our
Yeah.
listeners to be able to reach it.
Okay. Well, my phone number is 904-556-0156. And you can also reach me by email if you want. It's earljonesjr@outlook.com. I also put it in the chat.
And we will also put that up on our website. Mr. Hicks?
We can be reached at 800-716-1866. Also, you can email me directly at bhicks, as B as in Brian, HICKS, at INS, short for insurance, info broker.com. bhicks at insinfobroker.com.
Okay, well, that's very good. And we will put it up on our website. As Ms. Turner said, when we've only been doing this a couple of months, and we think we're getting better at it. At least I'm getting better. She was already good. So I'm just, I'm still a work in progress. And so we're trying to make it easier for our listeners, make it informative. And we hope that next week we can have our listeners join us we're going to talk about the Affordable Care Act because that's another complicated issue as well. And then we're still going to make a comeback at some point before the end of enrollment on the ACA and the Medicare sign-up period to help clarify some things that may show up during this sign-up period. Ms. Turner, I'm going to leave it up to you to go on ahead and help our guest give some summary of whatever.
Yeah, and I'm glad you mentioned about future conversations because I want to remind our listeners that you heard a lot tonight. As you can tell, I'm not an expert by any means. And if you have any ideas for future shows, please send us an email, post on our website, because we want to hear your ideas. If you need more information about the subject, of course, but I would like to invite both of our guests, and first of all, to thank them. You all were really helpful. Although I was teasing, I took notes, so I have a lot to refer back to. But I would like to ask each of you to give your final thoughts that you'd like to share with our listeners. And I'll start with you, Brian.
Well, the thoughts I'd like to share is that at the end of the day, it's insurance. And at the end of the day, it's about risk management. And your policy is just as individual as you. And it needs to fit your needs that way. So, and there's a lot of programs even outside of Medicare that will help in that effort.
I'm glad you said that because I failed to ask what resources, but I don't need to say that because you both have given your contact information, and so you are the resource. Thank you, Brian. Earl, do you have any final thoughts for our listeners?
I want to thank y'all for having me on, and also I know Medicare, even for me when I first became an agent, it can be complex at times, and so I just want to say that I'm hopefully I'll be here for a good resource for anybody who wants to reach out. I can if it's not enrolling, just if you got questions, feel free to reach out. I'll be happy to look into it for you.
Thank you so much, and we really appreciate that. Dr. Kane, do you have any final thoughts before we close out the show?
The only real final thoughts that I have is that I want to thank both of these guys for getting on the show. I want to make sure that our audience know that they can be used as a resource, not only by patients, but physicians as well. I use brokers such as Brian and Mr. Jones. I refer patients to them all the time because that's where they can get their best answers. The physicians, we may know, some of us may know some, but we're not the experts in terms of what best fits your Medicare needs. And I try to make sure it's about the patient's need and not about my wants as a physician in terms of monies, blah, 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 blah.
Yeah, and thank you, Dr. Kane. And I think Brian even said that earlier, and I appreciated that it's not about selling insurance. It's really about helping families, and that's what we look to accomplish from this podcast. We started the podcast, as I said in the very beginning, to be a resource for our listeners as you navigate the system of life, because life is complex when you're trying to navigate, for instance, our subject not tonight on Medicare. We want to make sure that we are a resource for you and will hopefully enlighten you and dispel some of the myths out there and really help you navigate the system. So tune in next week as we continue the discussion on insurance. Next week, as Dr. Kane said, we're going to talk about the Affordable Care Act. But thank you all for joining our discussion. Thanks to our guests as we talk tonight about Medicare, what you need to know.
Thank you for tuning in today to Pause for the Truth. We hope that you gain more knowledge about today's topic and that you will tune in next time to hear about what's trending and what you can do to help make life a little less complicated for you and your family. Growing our presence allows us to reach more people, so we need your support. Visit our website at www.pauseforthetruth.com. Like us on Facebook, tweet us on Twitter, link us with LinkedIn, but most of all, download the Podbean app to your mobile device and become a follower of Pause for the Truth. We have dedicated our careers to sharing knowledge. Now we ask you to pay it forward and invite others to Pause for the Truth. You can email question or show topic recommendation to us at info@pauseforthetruth.com. We would also like to give a hearty thank you to our behind-the-scenes technology engineer, Mr. Tyrone Jackson. You can contact him for your technology needs at www.calltyrone.net. Until next time, stay well, stay safe, and always remember, take time out to pause for the truth. This has been Dr. Rogers Kane and Ms. Jocelyn Turner signing off until next week. Good night.